After suffering from migraines for 15 years and doing some extensive research, I decided to try ozone therapy for the first time to decrease the number of migraine days I experience in a month.
We have to introduce the needle inside of the bottle, and we need to have outgoing to the ozone transfer set that's going to be coming from the bottle into the patient's vein, delivering ozonated blood back into the patient's body. Now we're going to initiate the machine. And I have to open up the oxygen tank. Here we go. Now we're going to choose our language, and we're going to go for the hyperbaric treatment. And now we're going to flush the system with Ozone. Now it's going to ozonate the entire system. It's going to clean it and sterilize it. We need heparin, because we can't do ozone without heparin. We need to heparinize the blood, otherwise it will clot during the procedure. We need to have a large gauge tubing, and we need to have a large needle, 20 gauge needle. Now we need to locate big vein, because it requires big vein to do the procedure. I'm going to clean it with alcohol. One, two, three. Secure it.
So what does ozone do when it's entering my body?
The first thing, it actually delivers concentrated oxygen to your body, and that itself improves blood circulation and oxygen delivery to ischemic tissue, owing to the concentrated effect of oxygen. It also, by improving oxygen delivery, it enhances the general metabolism. It upregulates the cellular antioxidant enzymes and induces some chemical processes. It actually induces a mild activation of the immune system and enhances the release of growth factor from platelets.
What does it mean when it's one pass?
One pass means we need to fill up 200 milliliters of blood in this bottle. You can see 200. And then we're gonna inject 73 gamma of ozone and mix it with blood and inject it back into the body. That's considered to be one pass, or it's considered to be called major autohemotherapy.
And how many passes would I need for migraines that I'm experiencing?
I would start with 3 passes initially, and then we're going to increase them by 1 pass every treatment for 9 treatments. So my idea is to get to 10 treatments by the end of the therapy to see some improvement.
Are there any complications with ozone therapy?
I know that there are. I've never seen one, but the main side effect that usually being reported, it's reported by people that have Lyme disease, and they develop symptoms that's called herxing, so which means it's a die-off syndrome when you have bacteria be killed after ozone and you have a flu-like symptoms for 12 to 24 hours, and then you feel absolutely normal. That's pretty much it. Okay, we're getting closer to completion of the 1 pass. The blood is getting closer to 200. Now we're gonna actually fill the cylinder with ozone. So machine is gonna fill up the chamber full of ozone. It's generating, it's drawing oxygen, medical oxygen into the machine, and ozone is being generated. Okay, the chamber is full. Now we've got exactly 200 milliliters of blood, and I'm gonna start releasing ozone into the blood, and the blood will be changing the color now. You can actually watch the blood, it will become very bright. It was very dark, and now it's getting bright. Much brighter. And now we're gonna add some oxygen to push the blood out of the bottle into the body. So the first release is going to be ozone, second release is with a pure oxygen. You see the blood is becoming much brighter. Okay, and now we reach the point that the blood is back, and we're going to start pumping blood back into the bottle for the second pass. Now the blood is going back. We're going to add heparin again. Blood is moving very nicely. You can actually see it right here. It's moving. So heparin. There we go. We have to maintain certain pressure for the blood to be removed out of the body. And the same process, shaking the bottle for the heparin to mix with blood. When you do high doses of ozone, it's known to be mobilizing stem cells in a bone marrow, and it basically activates them to be more active. Okay, we're going for number 3. We need to add heparin always. This is number 3. Always maintain appropriate pressure.